If you are over 60 and you take amlodipine, losartan, or lisinopril, there is a belief I want to challenge right away. Many people think that once a blood pressure pill is working, the hard part is over. The numbers look better, the prescription is familiar, and the danger must be behind them. But that belief is exactly where trouble often begins. Because what protects you can also mislead you when you stop paying attention to the details that matter after 60. I have seen older adults become very faithful about taking their medication, yet completely unaware of the silent problems growing around it. They blame age for swollen ankles, low energy, dry cough, weakness, nighttime dizziness, or a strange heaviness in their legs. They say, "This is just what getting older feels like." They assume their medicine is doing its job, so anything else must be normal aging. But sometimes, the real issue is not the prescription itself. The real issue is what most people still do not know while taking it. Amlodipine, losartan, and lisinopril are common medications. Doctors use them for good reason. For many people, they lower blood pressure and reduce risk. That matters. High blood pressure is often quiet until it steals something important. It can damage the brain, the heart, the kidneys, and your independence long before pain ever warns you. So this is not about fear. It is about understanding. And after 60, understanding becomes part of the treatment. I'm Dr. Caleb Mercer, and today I want to break 5 common beliefs that keep seniors from getting the full protection these medications are supposed to give. Some of these beliefs sound healthy. Some sound harmless. One of them sounds so reasonable that many people never question it until symptoms begin. And that last one changes how you should think about your medicine from this day forward. Before we get into it, tell me your age and which of these 3 medicines you take most days, or which one a loved one takes now. The first belief is one of the most common, and it sounds almost responsible. People think, my blood pressure numbers improved, so the medicine is handling the problem. That feels comforting. It feels settled. It feels like a box you can finally check off. But blood pressure control is not the same as total protection. You may think a better reading means your daily choices matter less now, but the real correction is this. Medication lowers pressure. It does not erase the conditions around that pressure. If your sleep is poor, your salt intake keeps creeping up, you sit too long, you are not drinking enough water, or you get up too fast and feel lightheaded, your body is still under strain. The number on the cuff may look better, yet your circulation, balance, and energy may still be telling a different story. What most people do not realize is that these medicines change the environment inside the body in different ways. Amlodipine relaxes blood vessels, which can help lower pressure, but in some older adults, it also allows fluid to settle in the lower legs and ankles. Losartan and lisinopril affect hormone systems that help regulate blood pressure and fluid balance, and that can be very useful. But it also means the kidneys, potassium levels, and hydration status matter more than many seniors have been told. So if your blood pressure looks better, that is good. But it is not the end of the conversation. It is the beginning of a more careful one. Imagine a man in his late 60s who feels proud because his readings are finally lower. He keeps eating the same salty canned soups, barely walks during the week, and assumes the medicine will carry the rest. Months later, he notices swelling, more fatigue, and unsteady mornings. He thinks he is simply slowing down. In reality, he is learning too late that numbers alone were never the whole picture. The better path is to treat the medicine as one tool, not the whole answer. Keep tracking your blood pressure, yes, but also notice patterns in swelling, dizziness, breathing, bathroom changes, and energy. Pay attention to how your shoes fit by evening. Notice whether you feel more washed out after hot days or after skipping meals. After 60, your body gives clues before it gives a crisis. And this is where the next belief becomes more dangerous, because many older adults have been taught to ignore those clues. The second belief is that side effects are just part of aging, so there is no point bringing them up. This belief keeps people quiet when they should be speaking. It turns useful information into silent suffering. You may think, I am older now, of course I get tired. Of course I get dizzy once in a while. Of course my ankles swell. Of course I cough more. But that easy explanation can hide a medication issue in plain sight. The real issue is not that every symptom comes from the medicine. The real issue is that too many seniors stop investigating the symptoms because they assume aging explains everything. Take amlodipine. One of the best-known complaints with it is ankle or leg swelling. Not every person gets it. Some never do. But when it happens, many older adults dismiss it at first. They blame warm weather, shoes, weight gain, or just getting older. They do not connect it to the pill because the pill is supposed to help them. Yet swelling is exactly the kind of thing that deserves a conversation, especially when it gradually worsens or changes comfort and mobility. Now think about lisinopril. Some people develop a dry, nagging cough that will not go away. It can feel minor in the beginning. Maybe it shows up at night. Maybe it seems like allergies. Maybe you start clearing your throat more and think the air is dry. But if that cough persists, it matters. Not because you should panic, but because your body may be reacting to the medicine in a way that deserves attention. Losartan may be easier for some people in that regard, especially if they had trouble with cough on another medicine, but it has its own points to watch. Weakness, changes in potassium balance, or kidney-related concerns can creep in quietly, especially when dehydration or other medications enter the picture. What most people overlook is how symptoms affect independence long before they feel medically dramatic. Mild dizziness becomes a near fall in the bathroom at night. Small ankle swelling becomes heavy legs that make walking less enjoyable. A dry cough becomes broken sleep and exhaustion the next day. A little weakness becomes a reason to stop gardening, shopping, or seeing friends. Older adults rarely lose independence in one giant moment. It is often chipped away by small things they were told were normal. If that idea hits home, subscribe for more simple guidance that helps you question what feels normal and protect your independence longer. The better path here is not to become frightened of every sensation. It is to become observant and specific. If a symptom started after a medicine change, say that. If it is worse in the evening, say that. If your rings feel tighter, your socks leave deeper marks, your cough came out of nowhere, or you feel faint when standing from a chair, say that too. Specific details help your clinician decide whether the medicine, the dose, the timing, or something else may need attention. And that leads into a third myth that sounds healthy, even wise, which is exactly why it fools so many careful people. The third belief is that if something is natural, heart-friendly, or sold without a prescription, it cannot cause trouble with blood pressure medicine. This is one of the most stubborn myths after 60 because it often comes from good intentions. People want to eat better. They want to support the heart naturally. They want fewer pills, not more. The intention is good. The assumption can be risky. You may think, bananas are healthy, salt substitutes are better than salt, herbal products are gentle, and over-the-counter pain relievers are common, so how much difference could they make? But the dangerous part is that some of these choices matter more when you are taking Losartan or Lisinopril, and some matter when you are on Amlodipine too. For example, some salt substitutes use potassium instead of sodium. That sounds smart on the surface. Less sodium, more heart-conscious, right? But if you take Losartan or Lisinopril, potassium may already deserve monitoring. Adding more without realizing it can become a hidden problem for certain people, especially if kidney function is not perfect. This does not mean potassium-rich foods are bad or that everyone must avoid them. It means the word healthy is not enough. Context matters. The same goes for dehydration. Many seniors work hard to reduce swelling or avoid frequent bathroom trips, so they drink less than they should. Then hot weather comes, or a stomach bug, or a long afternoon outdoors. Suddenly, the body has less fluid to work with, while medicine is still doing its job. The result can be dizziness, weakness, or kidney stress that feels mysterious unless you understand the connection. And then there are common pain relievers. Many older adults reach for them without a second thought when the knees ache or the back stiffens up. But some pain medicines can affect blood pressure control or strain the kidneys, especially when used often. The person taking them may never suspect that the combination, not just the arthritis, is part of why they feel off. Picture a woman who decides to be healthier after a checkup. She swaps regular salt for a potassium-based substitute, starts drinking less because she hates nighttime trips to the bathroom, and takes extra pain relievers for her hip. She believes she is making sensible choices. Weeks later, she feels weaker, more lightheaded, and less steady. She does not blame the changes because each one seemed harmless by itself. But the body feels the total load, not the good intentions behind it. The better path is to treat every new supplement, salt substitute, or frequent over-the-counter medicine as part of your medication story. Mention it. Bring the bottle if needed. Ask whether it fits safely with what you take. That question can prevent a problem long before symptoms force your attention. But there is another belief that may surprise you even more, because it hides inside a routine almost everyone trusts. The fourth belief is that taking your pill every day is enough, so timing, meals, posture, and routine details do not matter very much. This myth sounds disciplined. It sounds close enough to the truth that people stop there, and that is exactly why it causes trouble. Yes, consistency matters, but after 60, the way you take a medicine can shape how your day feels more than many people expect. Some older adults take their blood pressure medicine and then skip breakfast. Some take it after a hot shower, then stand quickly and rush into chores. Some take it late one day, early the next, and assume that because they never miss a dose, the body will simply adapt. Sometimes it does. Sometimes it does not. The real issue is that older bodies often have less margin. Blood vessels may respond differently. Thirst signals may be weaker. Balance may already be a little more fragile. Kidney reserve may not be what it was at 40. So small timing mistakes can create bigger consequences. Imagine taking your pill, not eating much, walking outside in warm weather, and then feeling suddenly washed out when you bend down and stand back up. That may not mean the medicine is wrong for you. It may mean the routine around it needs work. Imagine taking amlodipine and sitting most of the day, then wondering why your ankles are fuller by evening. Imagine taking Lisinopril or Losartan, barely drinking fluids because you are trying to avoid the bathroom, and then feeling weak and foggy by mid-afternoon. These are daily life collisions, not abstract medical theories. What most people do not realize is that routine can either support the medicine or fight against it. A simple habit like rising more slowly from bed, giving yourself a little water, eating regularly if that is what your clinician advised, and noticing how heat affects you can change the whole experience. Keeping a stable schedule matters too. The body likes patterns. After 60, those patterns often become the difference between feeling protected and feeling drained. This is also the point where family members can help without taking over. A spouse may notice the evening ankle swelling before you do. A daughter may notice you cough more at night. A neighbor may see that you always seem woozy after working outside. Sometimes the people around you catch the pattern your pride wants to dismiss. So the better path is not simply take the pill. It is build a routine that helps the pill work safely inside your real life. Notice timing. Notice hydration. Notice heat. Notice meals. Notice how fast you stand. That kind of awareness is not anxiety, it is skill. And still, that is not the biggest misunderstanding. The final belief is the one that leaves many seniors feeling blindsided because it convinces them that feeling fine means everything must be fine. The fifth belief is that if you are not having obvious symptoms, there is nothing important left to watch. This is the myth that quietly steals time. It tells people that silence means safety. But with blood pressure treatment, silence can be deceptive. Amlodipine, Losartan, and Lisinopril can help for years, and many people do very well on them. But the body changes. Kidney function can change. Other prescriptions can be added. Weight can shift. Appetite can change. Illness, heat, travel, poor sleep, and even grief can alter routines in ways that affect how a medicine feels in the body. What worked smoothly 2 years ago may deserve a fresh look now. You may think, if something were wrong, I would surely feel it. But many important issues do not announce themselves early. Blood pressure can drift too low at certain times of day. Swelling can build slowly enough to seem ordinary. Potassium or kidney concerns may not feel dramatic in the beginning. That is why occasional follow-up, home readings when recommended, and paying attention to changing patterns matter so much. The dangerous part is not only what goes unmeasured, it is what goes unmentioned. Many older adults do not want to bother the doctor. They do not want to seem difficult. They are grateful for the prescription and do not want to question it. But speaking up is not complaining. It is participating. A quiet patient can still be a poorly protected patient. Think about the older man who starts feeling more tired after lunch every day. He assumes age is catching up. His daughter notices he seems pale and slower to get up from the sofa. He brushes it off. Months pass before anyone connects the pattern to low blood pressure at certain times and a routine that no longer fits his needs. Or think about the widow who accepts a constant cough because she does not want to make a fuss. She sleeps poorly, grows more exhausted, and gradually loses confidence leaving the house. The medicine may still be lowering pressure, but her quality of life has been shrinking in the background. This is where medication wisdom after 60 becomes different from simple obedience. It is not enough to take the pill and stay silent. The better path is to stay engaged. Know the name of your medicine. Know why you take it. Know what changes deserve a call. Know what other products may affect it. Know what your body has been trying to tell you. Let me make this even more practical because this is where many viewers finally recognize themselves. A lot of older adults do not get into trouble from one dramatic mistake. They get into trouble from a stack of small assumptions. The medicine is familiar. The refill is routine. The pressure cuff reading seems acceptable. So they stop asking deeper questions. But blood pressure treatment after 60 is not just about pressure. It is about circulation, fluid balance, kidney strain, steadiness, sleep, and how your body handles ordinary life on an ordinary Tuesday. Take the simple belief that a little ankle swelling is nothing. Many people think if the swelling goes down overnight, it cannot matter. But that is not always the right conclusion. When your legs feel heavier by evening, when shoes fit differently, when socks leave deeper marks, your comfort changes first. Then your movement changes. Maybe you skip the walk after dinner. Maybe stairs feel less inviting. Maybe you sit more because your legs feel tight. Then your circulation, balance, and confidence can slowly worsen. The swelling may seem cosmetic, but the consequence becomes practical. That is why a side effect should be judged not only by how dramatic it looks, but by how much it changes the life you are able to live. The same kind of misunderstanding happens with dizziness. Older adults often say, "I only feel lightheaded for a second, so it is not serious." But after 60, a second can be everything. A second while turning in the kitchen, a second while stepping out of the tub, a second while getting up in the dark to use the bathroom. That brief drop in steadiness can become the moment that leads to a fall, a fracture, or a deep loss of confidence afterward. Even when the body heals, many people never feel quite as sure-footed again. That is why a short episode deserves respect. And then there is the emotional side of this that people rarely discuss. Some seniors become afraid to report symptoms because they worry the answer will be more tests, more pills, or bad news. So they stay quiet. They say nothing about the cough, the leg heaviness, the sudden fatigue after lunch, or the strange weakness on hot days. Silence feels easier in the short term, but it usually costs more later. The body does not reward silence. It rewards attention. Another myth hidden inside these medicines is the idea that all blood pressure pills are basically interchangeable in daily life. People hear that all three lower blood pressure, so they assume the day-to-day experience should be similar. But what most people do not realize is that the body can react very differently depending on which pathway the medicine affects. One person may do very well on amlodipine, but struggle with swelling. Another may tolerate Losartan nicely after being miserable with cough on Lisinopril. Another may be fine for years until a change in kidney function, hydration, or another prescription alters the balance. The important lesson is not to compare yourself loosely to a friend or neighbor. It is to watch your own pattern closely. I have seen couples do this all the time. The husband says, "Your sister takes that pill and she is fine, so yours cannot be the issue." Or a friend at church says, "I have been on it for 10 years and never had a problem." That may be true for them. It does not settle what is happening in your body. After 60, two people can have the same diagnosis and the same medicine, yet a very different experience because the rest of the body story is different. This is also why home blood pressure readings can be helpful when your clinician recommends them. Not because you need to become obsessed, not because you should check every hour, but because patterns tell stories. Maybe your morning numbers are reasonable, but you feel washed out after lunch. Maybe your pressure is fine sitting down, yet you feel dizzy when standing. Maybe you feel poorly only on very hot days, only after yard work, or only when you have not eaten enough. Those details can help explain why a medicine feels fine at one time and too strong at another. A useful question to ask yourself is this: do I only know my medication by name, or do I know how it behaves in my life? That is a very different level of awareness. Knowing the name is basic. Knowing that your ankles get puffy by evening on amlodipine, that a dry cough began after starting Lisinopril, or that weak, shaky days happen when you get behind on fluids while taking Losartan, that is the kind of awareness that protects you. And please do not overlook the role of appetite. After 60, some people eat less without meaning to. Widowers eat more simply. Busy grandparents skip lunch. Dental issues make certain foods harder to manage. When appetite changes, hydration and energy often change with it. Then the medicine enters a body that is not working from the same foundation as before. You may think the pill suddenly became a problem, when in reality, the body around the pill changed first. Sleep matters here too. Poor sleep raises stress hormones, changes appetite, affects balance, and can make you feel weak or headachy even when the medicine itself has not changed. Then many people blame the prescription for a miserable day that actually began with a bad night. The opposite can also happen. A cough from lisinopril or repeated bathroom trips from late fluid habits can disturb sleep, and the next day the person feels tired, foggy, and discouraged. Without careful thinking, every piece gets blamed on age. This is where a notebook can become more useful than people expect. Nothing fancy, just a few lines. What time you took the pill, whether you drank enough, whether you felt dizzy, whether your ankles were swollen, whether you coughed more at night, whether you were out in the heat. A short record can reveal patterns your memory will miss. It also helps when you speak with a clinician, because you are bringing evidence from your actual life, not just a vague feeling that something seems off. There is another assumption I want to challenge, and it is especially common among strong, independent adults. They think asking questions means they are being difficult. They do not want to seem needy. They do not want to bother anyone over what feels like a small issue. But responsible aging is not quiet obedience. Responsible aging is informed participation. It is saying, this medicine helps me, but I also notice this new cough, or this evening swelling, or these dizzy spells when I stand after gardening. That is not being difficult, that is being useful. The real danger of passive medication use is that it teaches people to become strangers to their own body. They swallow the pill, move on with the day, and stop connecting cause and effect. Then months later they are shocked by how much their stamina changed. They say, I do not know when this started. Often it started with something small that felt too ordinary to respect. Let me give you a simple comparison. Imagine two women, both 72, both taking a blood pressure pill. The first woman takes it faithfully and never asks another question. She ignores swelling because it is not painful. She ignores dizziness because it passes quickly. She ignores the dry cough because she does not want another appointment. The second woman takes the same health issue seriously in a different way. She still takes the medicine faithfully, but she also notices patterns, writes down changes, asks about a salt substitute, mentions the swelling, and learns how heat affects her. A year later, which woman is more likely to feel steady, informed, and in control? Usually the second one. Not because she was luckier, because she stayed involved. There is also a food timing issue that many older adults never connect. Some people take their medicine, then have a very long gap before eating or drinking much. Others take it with coffee and call that enough. But caffeine, heat, poor sleep, and low fluid intake can create a rougher day than expected. Again, this does not mean there is one perfect routine for everyone. It means your routine should be deliberate, not accidental. Some viewers may be wondering, should I be scared of these medicines now? No, that is not the point. The point is to respect them. Respect is different from fear. Fear makes people stop treatment, skip doses, or panic over every symptom. Respect makes people learn, observe, and communicate. Respect makes you less vulnerable, not more. And if you care for a spouse or parent, you have a role here too. Listen for small phrases. I feel funny when I stand up. My shoes are tighter at night. I keep clearing my throat. I feel worn out after being outside. Those little comments are often early clues. Loved ones can help connect the dots without becoming controlling. A gentle question can do a lot. When did that start? Does it happen every day? Is it worse after taking your pill? That kind of calm curiosity can protect someone you love. There is one more belief hidden under all the others, and it may be the most damaging of all. It is the belief that getting older means accepting avoidable discomfort. That belief steals quality of life. It convinces good people to tolerate things that may be improved. Maybe not perfectly, maybe not overnight, but improved. Better sleep, less swelling, fewer dizzy spells, more confidence walking, more energy for errands, church, grandchildren, or a quiet evening meal without feeling wrung out. These outcomes matter. What makes this title so important is that amlodipine, losartan, and lisinopril are not unusual medicines taken by a tiny group. They are common. That means the misunderstandings around them are common too. And common mistakes are often the most dangerous because nobody sees them as mistakes. They see them as normal life. They see them as age. They see them as something to endure. But what sounds normal is not always harmless. So if you remember nothing else, remember this. A blood pressure prescription is not a finish line. It is an agreement. The medicine does its part when taken correctly. You do your part when you stay awake to what your body is saying. That partnership is where real protection lives. One more practical reminder matters here. Medication problems do not always look dramatic. Sometimes they look like smaller routines shrinking. You stop taking the long aisle at the grocery store. You choose the chair instead of the walk. You decline an invitation because you feel unusually drained. You hold the railing tighter than before. These are quality of life signals. They count. When you notice them early, the conversation with your clinician becomes clearer and calmer. You are not saying the medicine failed. You are saying your life around the medicine changed, and you want to stay ahead of that change. That is a wise approach after 60. So ask simple questions. Could this swelling be related? Does this cough matter? Am I drinking enough for this medication? Should I be careful with salt substitutes or frequent pain relievers? Do my home readings suggest a pattern? Those questions are not signs of weakness. They are signs that you plan to keep your independence, not surrender it quietly. And remember, the goal is not to become suspicious of every pill. The goal is to become a better observer of your own body. That shift alone can change appointments, prevent confusion, and help you stay stronger in the places that matter most for everyday independence: walking, sleeping, thinking clearly, and living well longer. If this has been useful so far, give this video a like so more older adults can find information that may save them worry. What most seniors still do not know is not that these medicines are bad. It is that blood pressure medicine is not a one-time decision. It is an ongoing relationship between the pill, the body, and daily life after 60. The person who does best is usually not the person who never asks questions. It is the person who notices patterns early, reports them clearly, and understands that protection comes from partnership, not passivity. So let me bring all 5 myth breakers together. Better numbers do not mean the whole problem is solved. Symptoms should not be brushed aside as just age. Natural products, salt substitutes, dehydration, and common pain medicines can matter more than they seem. The way you take the medicine in real life can shape how steady and energetic you feel. And feeling fine does not remove the need to keep watching, learning, and speaking up. That may sound like a lot, but the good news is that none of this requires perfection. It requires attention, small attention, the kind that protects balance, confidence, and freedom. Check your ankles, notice your cough, track your readings if you were told to. Watch how you feel in heat. Ask about supplements. Tell someone if you feel faint. These are not dramatic acts. They are the quiet habits that keep small problems from growing into larger ones. And please remember, this is educational, not personal medical advice. If you have kidney disease, heart problems, diabetes, medication changes, or specific monitoring instructions, speak with your own clinician before adjusting anything. You are not fragile because you need medication. You are wise when you learn how your body responds. After 60, staying independent is rarely about one heroic act. It is about noticing sooner, adjusting earlier, and refusing to call every warning sign normal aging. Share this with a spouse, sibling, parent, or friend over 60 who takes blood pressure medicine and still thinks feeling okay means knowing enough.